again, this is Audrey Gravador and I am a medical student here in the Philippines. So if you have watched my previous videos, I am actually a licensed physical therapist here in the Philippines. Now, I received a lot of questions regarding the Doctorate of Physical Therapy program and its difference between the pathway towards becoming a physician here in the Philippines. So I collected some of these questions, and I also remembered that a few years ago I was also confused and I sought help to a good friend of mine. He is Dr. Serge.
Hi, good morning, everyone. I'm Serge Sarsa Jr. You can call me Serge. I'm a physical therapist. Let's start with that. I'm a physical therapist. I did my bachelor's in the same school that Audrey graduated in, also in Velez College. But I went beyond that and did my doctorate in physical therapy degree in Loma University in California. For the past 5 years, I've been working as an assistant professor and a physical therapist in one of the universities here in Cebu. And I'm also the chief physical therapist in one of the rehab centers in the province as well. And I also have another job, which is more of a clinical process oriented job, where it's in the evening. So I have a pretty heavy plate for the day.
So, how did you get your Doctor of Physical Therapy degree, and can you take them online or on-site? So, what are the advantages and the disadvantages?
Unlike most of the Filipino PTs who went into getting their DPT degrees online, I had the opportunity to study the DPT degree on site in the United States. At the end of the day, yes, we still become a DPT. I guess one advantage there was that it allowed me to take the US state license exam a little faster because I'm already there.
So, what is the path towards Doctorate of Physical Therapy look like compared to an MD? Because a medical degree is a 4-year course. After you take a pre-med program, and then after your postgraduate internship and you pass the board exam, that's when you decide which residency you want to take. So if it's family medicine, internal medicine, or PM&R. So are there any fellowship degrees or residencies for physical therapists after the doctorate?
If the question is why did we pursue the DPT degree, the first reason would mostly be you want to upgrade your skills. There's a lot of things that you don't. That's not to say that our undergraduate education in the Philippines isn't bad. It's just that specialty practice, especially if for us, for example, I want to be an orthopedic clinical specialist, which I'm going at in right now. You get to learn advanced techniques which are not taught at the undergraduate level with a DPT degree. Another reason why is that, to a more pragmatic reason, is for state licensure. For the United States, you see, you need a lot of the states require some form of advanced education. That's why a lot of the agencies also require you to have this promo where they bundle up. You sign up with them and they'll pay for your DPT degree. Those are probably two main points that people get a DPT degree, at least from a pragmatic sense, for where I'm coming from. I think another point of contention that a lot of people get confused, and as what you've mentioned, is where does the difference lie between a DPT and an MD person? Let me take it from the perspective of the United States. We're both allied health professionals. Physical therapists, specifically the DPTs, are movement experts. We're movement specialists. Well, actually everywhere. We're movement specialists. Our scope of practice is limited and is deep in movement science. Our goal as physical therapists is to help the patient move again. Physicians are, on the other hand, take the person not just in the musculoskeletal system, but for the rest of the systems. That's why they become general practitioners and They take the person in totality and look at all of the rest of the systems of the body. There may be some overlap, but but let me put it this way: for the physician looks at the person as a whole. They look at the big picture. And then if they go into residency and fellowship, you tend to specialize in an area you're probably interested in. Orthopedics, neurology, OB/GYN, surgery. And you specialize in that. The PTs or the DPTs or basically any licensed therapist, our specialty is on movement. So if you notice, I emphasize a lot on the term movement. Physicians, if you look at it from the disability model, there is a great focus on the physiological impairments of the patient or client. The physical therapist, on the other hand, are on the other side of the spectrum. We're more involved. Yes, we do get involved with the physiological impairments, but we deal more with the activity restrictions, participation restrictions, which on the other hand is to make their patients and clients move better. That's why you have this very common saying that doctors add years to your life, but physical therapists add life to your years, because because the doctors give you the MDs help you get in a better place for you to be able to move again, and the therapists, PTs, and as well as our other fellow rehab professionals, we give meaning and purpose to your movement so you can have a more significant life, as you would say.
So, Doc, if you want to apply for an on-site Doctorate of Physical Therapy degree, so how should you strengthen your application? Because I know that it's quite different if you try to apply via online or on-site.
It's easier in the sense that you're able to just literally apply online, and you can submit your requirements online. I can only speak from my experience, because there are only a few schools left that offer on-site DPTs. But to give a disclaimer, the university where I'm currently working at paid for my DPT degree, and they preferred me to do an on-site DPT degree, because I actually had the option to do the online DPT degree. The reason why they wanted me to do the on-site degree was more for the skills acquisition. And in terms of requirements, I don't maybe online, from what I know, based from what I've heard from my friends who was also doing their DPT, some of the requirements tend to be a little more relaxed. Obviously, the biggest challenge for Filipinos who want to do an on-site DPT, to be honest, it's not going in the school itself. The first hurdle is the English exam. The TOEFL is a big challenge for many Filipinos, and a bigger challenge is attaining that minimum pass score. For example, to give you perspective, the FCCPT requires you to get 26 in speaking. For most schools, I think they want you to have a minimum of 80 or 90 up total of the TOEFL score out of 120. The GPA, from what I've heard, is not as, unless you're applying for some scholarship, I know that would matter for them, but in generally speaking, for GPAs, as long as you have good grades, or if you come from a challenging school, or if you come from Velez, kanang generosity is an option of the teacher. So they're not too strict about that. They look at you more as a whole person. I think what sold me with the on-site school where I studied was that I gave out my work experience. So you need to have a good balance of academics and work experience when you give your application out, and strong recommendation letters, and also your English skills. If you really want a good leg up with your application, I think the English skill does play a part. I think that's also partly why I got into the university, because I think I got 118 with my TOEFL, which is just 2 points away from the perfect score. They do look into that, because if you're going to an on-site school, the biggest thing for you is that you will be communicating with your fellow classmates and your teachers in the United States. Online, from what I've been told, is a combination of situations like this where it's live video conferences, or just post in a forum, or answer comments. Communication's one thing. Academics, yes, it's significant. Communication, I think, is a big challenge for most Filipinos. That's why I emphasize that quite a lot. And when you apply, make sure that you have, if you're a fresh grad, then probably try to add some experience first. Work out in the clinics, volunteer, or if you get lucky and you get a full-time job, then do that. At least get your feet wet in the profession, because unlike the Philippines, to be honest, most US schools look at work experience a little more intently compared to us here, where it's mostly academics.
Yeah, that's very true. Beyond the definition of becoming a branch of medicine and a physical therapist, I really want to stress this out. There is a common misconception that physical therapists are the same as massage therapists or exercise coaches. So what does a rehab therapy session look like? So can you talk about the consequences of events that happens in a rehab team?
If we're talking about the practice here in the Philippines, it's fairly straightforward. As long as you get even a simple one-liner from the physician that would say, please evaluate and treat. And once you give that to the physical therapist at the very first stage would be to screen you if you have any other medical conditions that would contraindicate you to physical therapy. Of course, when you have unstable vital signs, or during screening you find out that there are certain signs and symptoms that do not match typical musculoskeletal, neurologic, or typical movement pattern restrictions. For example, constant pain that won't go away. That's a very big red flag. So that's where red flags and yellow flags come in quite importantly. And that's where the physician's role comes in, actually. Because the physician is actually the physician ideally should have screened the patient first prior to coming to therapy. But sometimes in some settings they just give you a simple eval and treat sign. So that's where we come in as well. We're not taking the role of physicians, but rather we screen the potential risk for possible medical high risk situations. Let's say that the patient was cleared. There are no red flags or yellow flags that would preclude the patient from therapy. The therapist would then create a comprehensive initial evaluation that would outline what exactly are the movement restrictions and the movement problems that the patient or the client has that impacts their function and their quality of life. After that comprehensive evaluation, the therapist would then prescribe and give the patient their possible outcomes. They can discuss visit dates, and they can discuss the frequency of your therapy visit days. Although I do recognize that in the Philippines, it's more of only us telling the patient na okay, come here every day, for 1 hour. So once you have that discussion of visits, then you set your appointment and do your therapy. And the actual therapy part is where people can get creative. There are different ways to do physical therapy. I have an inclination into orthopedic physical therapy. That's why my arsenal, if you will, is mostly into manual skills. Some therapists like to use modalities. Some therapists like to use instruments. And if someone might ask which method is better, my simple answer is whatever makes you feel better. Now, if you go into the scientific evidence about that, then that's where it gets very debatey. And I think that's another conversation for another time. And at least for me, in my clinical practice, I give a set date and a set frequency that after this number of visits, I joke with my patient, I don't want to see you anymore. My goal is to not see you anymore. That's actually, I joke with them on that, but it carries some weight because what I'm conveying to the patient is, I'm here only for a set number of times, so you need to work with me in making your goals work. And then once everything works out and you've attained your goals, then you discharge the patient. And then it becomes a cycle again. You can, if they have another movement impairment problem, they can come back to you once they come after a physician. And I think that's the whole cycle in general. And I think it's the same setup as in the United States. The only key difference is that there are some states in the US where patients can go to you without any referral from a physician.
That's a good add up, Doc. I was about to ask that question after. So, okay, so what's the difference between a physical therapy diagnosis and a physician diagnosis?
That's always the biggest debate between the MDs and the PTs, especially in the Philippines right now when they're planning to edit or to revise the physical therapy law. The main contention really is that when you mean medical diagnosis, who can diagnose stroke? Who can diagnose you with cerebral palsy, what GDD, whatever? It's the physician. The physician gives you a physiological diagnosis, which is that medical diagnosis, which is the actual physiological condition. The physical therapy diagnosis, to be specific, is the movement restriction, activity restriction, or participation restriction that restricts a patient's ability to participate in the community. So if the physician, for example, will say that you have a left CVA with right hemiplegia, that's a medical diagnosis. The physical therapy diagnosis would most likely be impaired endurance and weakness on the right upper and lower extremities. Then you might probably ask, aren't you just simplifying what hemiplegia is? Well, yes and no. To be more specific, the PT diagnosis, if you look at it, actually gives you a more outcomes-oriented approach. Because when you say the patient is hemiplegic with stroke, the patient has stroke. So what do? You just do about with the management for stroke. But when you say that the patient has impaired muscle endurance, impaired muscle strength, that would imply that there is a goal for you as the physical therapist to improve those impairments so that the patient can participate more in the community as a whole, which is ultimately the goal for physical therapy. You resolve the physical impairments that preclude the patient from participating in the community so that they can live their best lives, if you will.
How can Filipino doctors help the rehab team more, especially the PTs, the OTs, and SLPs?
I appreciate the question, and the simplest answer is, by law, you can actually refer your patients directly to rehab.
That's true.
Because I think there is a common misconception that you wanted to refer to physical therapy, you had to go through the rehab doctor first, then the rehab will refer to the PT. But the existing laws actually only state that any physician can refer. I gave the simple example that there are some physicians who just give a simple referral that says evaluate and treat. So I think for me, we can say a lot of things, but that's the simplest and the most tangible change I think that physicians currently can participate in if we really want to help the rehab team. And also, I want to say that it's not to preclude that the rehab med team is not important. We are simply reiterating what is prescribed in law. There is no legal imperative for physicians to route all your cases to rehab medicine for therapy, when in fact, the existing physical therapy law simply states that any physician, even a GP, as long as you have a PRC license, you can refer your patients to physical therapy. It becomes a conversation between the therapist and the physician, because then we can have a conversation for example, at the start of rehab, I would screen a patient and I could see some signs that are not consistent with a diagnosed movement pattern. For example, there is the patient complains of pain on the left shoulder. And diba, if it's mostly musculoskeletal, it's only episodic or it's only intermittent. But what if the patient has constant pain? You would know for medical screening in your undergraduate degree nga, hala, that might be a possible a sign or symptom of a possible, it might either be a Pancoast
Uncles
tumor or
tumor, yes.
yes, diba, the pinakahalata nga board exam question, Pancoast tumor, heart attack. If the patient came to you with that kind of a referral system, that would be something I would raise with the physician. But I won't diagnose the patient nga, Doc, murag Pancoast tumor man tingali ni kaysa, because it's maybe the patient has Pancoast tumor. Well, no, I don't diagnose that, but I simply tell the physician that, Doc, the patient is presenting with constant pain on the left shoulder that does not resolve with any modality. I'm referring the patient back to you for your further evaluation. What I can do at my point as a physical therapist is to enumerate the signs and symptoms why I'm referring the patient back to the physician. For example, the patient presenting with constant pain that is not relieved with any physical therapy modality and is constant both in the evening and night and increases during the night. I'm not on my head, I already have an idea of what the possible medical diagnoses are. But I'm not going to say that that's not, because in the first place, that's not already the job of the therapist. That's outside the scope of physical therapy. We give the signs and then refer back to the physician so the physician now can make the appropriate medical diagnosis. So you see where the diagnosis thing comes into play. We don't diagnose the actual disease, if you will. We are more involved with the signs and symptoms and how they impact the patient's functions.
More functional. So, last question, Doc Sarsa. So, do you have any tips on how to decide if you want to go for the Doctorate of Physical Therapy rather than the Doctor of Medicine? And this also goes for the students who are watching right now and who are planning to take their medical residency abroad. So, what are the chances of getting a spot in residency as a DPT compared to an MD?
So I'll go with the first one. Where do you go if you want to do a DPT or an MD degree? It's more of your personal decision. Siguro, if I was a graduate right now, and I had to debate if I want to go into medicine or if I want to go into a DPT, I would probably ask myself first, where can I imagine myself I would commit to for the next 5 years of my life? Because both actually are significant undertakings. In medical school, you are immersing yourselves in the academe for the next 5 years. As a full-time student, you are extending your financial dependence on your parents for the next 5 years. Or if you go into physical therapy or to a DPT, or let's say if you want to do the typical agency route, so you're working, but at the same time you're doing your DPT, you're not as financially dependent, but you still have the challenge of leaving the country, as the case right now is, where the challenge for most physical therapists who want to work abroad right now, it's trying to leave the country that is the biggest issue, because there's a lot of that are currently making it difficult for therapists to leave for the United States or other English-speaking countries. For me personally, I don't think one is better than the other. Both are equally important professions and degrees that help augment our profession. The only thing which does not sit well with me is the perception of how physical therapists are seen here in the Philippines. Let's be honest. We still have not shed that perception that physical therapists are masajistas, or we're just PT technicians in the team. When in fact the training that we had in Velez and in most schools is that we're actually geared as independent practitioners, same as that in the United States. And when I studied in the US, my Indian classmates told me that although they graduated with a Bachelor of Physiotherapy degree, bachelor lang ha, they get to be called doctor at that onset. at the onset of their graduation. That's how high they regard physiotherapists are in India. And the same with my Nigerian classmates as well. So it comes down really to a perception of the profession in the place where you're living at. Obviously, in the Philippines, it's a hit and a miss. You can be a good PT, you can be a masahista na PT. It would really depend on how you play your cards out. For me, I'm lucky because I get to practice the profession as a literal physical therapist without being told na ay gipisil na pod ko ni doc or gihilot na pod ko ni doc. when we do manual therapy, that's always that's the most significant perception man good, especially when you do manual therapy. They always perceive it as ay gihilot ra ko kana sino siya lang gihilot. Well, no, it's not. It's actually skilled intervention. Both are significant undertakings. So, siguro, the main difference of the DPT is that if you do the fully online option, then it's just like work from home right now. Like, I'm working from home. My PC is right here. I can start working if I want to. But, and this is my laptop. So, but when you go back into the on-site situation, it becomes a very big undertaking. And regarding residency, physical therapy residencies are just as competitive as medical residencies in the US. The main difference is numbers. There's just a lot of international medical grads. Now, you're not only competing against other Filipinos who are studying, who want to go into residency in the US, you're competing against all of the
You
foreigners
don't
who
know who
have
your
dreams to go
competition
into the
is.
US
Yeah.
as well.
Mm-hmm.
True. As from what I've heard, so so the school where I did my DPT, they have a medical school as well. They have apparently the competition rate for residency slots are extremely high, because for every one position that opens up, 100 would probably apply. You're not only competing against other international medical graduates, you're also competing against actual American graduates. And there's always a preference to getting the Americans first. If the Trump administration is anything indicative of the sentiment of the Americans, is that there is a high preference for Americans to get hired first, which of course is not necessarily wrong, because that is of course their country and that is their prerogative. What I'm simply saying is that it's a reality for anyone who wants to go into residency that that's your competition. You may be the smartest Filipino in the application pool, but as long as there's an American there who has the same qualifications, they will always get hired before you. The same thing goes into physical therapy residency. From what I've heard, it's not, compared to the level of competition to medical residency, it's not as robust as that. But a challenge for international graduates is that if you want to do a residency in the US, you have to deal with visa problems again. So if you really want to go into residency, like let's say, okay, let's see two routes, that you're an MD graduate and you want to do a US residency there. So I think I've already explained quite well what would happen, what the typical route would be. For the physical therapy residency, you might probably get a slot into a fellowship program, but it becomes an entirely different animal in applying for a US visa. Because if you're going for residency, for physical therapy residency, I'm not even sure what kind of visa you would get into, because you're not an F1 student visa. I think you might fit in one of those short-term work visas. But again, it's a very deep story, give or take. That's what your possible outcomes are. Either way, they have their own challenges.
Okay, so thank you so much, Doc Sarsa, and I hope to see you soon next time.
I know.